everybody. My name is Dr. John Lucio. I practice integrative medicine and pain management in Jefferson City, Missouri, and welcome to our channel, J&J House Call. This is my wife.
Hi, I'm Dr. Jennifer Sue. I practice conventional gynecology and integrative medicine. And Kona's right there. She's our English Mastiff. And you might see Gia kind of wandering around a little bit.
Yep. We're filming from a different location in the house today. We thought it'd be a little different just to freshen things up a little bit. Yeah.
If you've never subscribed, please do so. We love integrative medicine. We cover topics twice a week. We were a little bit behind because we did 2 trips 2 weekends in a row, learning more for you guys. But we usually upload one on Sunday and one between Wednesday and Thursday. Yep. So always hit the subscribe button and then hit that notification bell so you know when we've uploaded our next video.
Today we're going to be talking about Nsaids. That stands for non-steroidal anti-inflammatory drugs. And it seems like almost every day someone picks a pill up just to take care of a headache or a sprained ankle or so on. And I've got a lot of my patients in my clinic who have Nsaids or who've been on Nsaids for a long time, and there really are some significant side effects everyone should be aware about. Probably one of the most common ones is if you take it on an empty stomach, you tend to have gastritis or abdominal pain. Take it long-term use. You can have peptic ulcer disease develop as well. You can get bloating.
Whenever you eat that non-steroidal anti-inflammatory drug, make sure when he said you have to take it with food, it's not just a few crackers. You have to take it with a meal. It's not just a little bit of food.
Probably one of the most important things, especially as we get older, it can increase your risks of stroke and heart attacks. And this is surprising to a lot of my patients. I always talk to them about this. And it can also raise your blood pressure as well. And there's a lot of people that have high blood pressure, and once you get over the age of 50, the rate of heart disease starts to increase as well. So you really need to be aware of that. And the FDA, the Federal Drug Administration, actually put out a warning in 2005 and actually strengthened that position again in the last few years because of the increased risk of heart attacks and strokes while you take these medications. The surprising thing is a lot of these medications, you can actually increase that risk just within the first week of taking the medication on a consistent basis. And that's surprised a lot of people because it really doesn't take much. And it does show that, the studies that do show that you can increase the risk of a repeat heart attack within a year if you've had one previously. So if you already have a risk factor of heart problems, you've had a heart attack, and you take that NSAID within that first year, you are increasing your risk of having another heart attack, which is of concern to a lot of people. It used to be thought that all of the drugs in this class were at equal risk of causing increased risk of heart attacks and strokes. And they found that that wasn't simply true. Those drugs like naproxen tend to be a little bit safer. So if you already have heart problems and you need to take an NSAID, it's probably the one to choose. That's the Aleve, that's the over-the-counter Aleve, and there are prescription strengths as well. It's better than taking ibuprofen. But all of them in that class do increase your risk. And it does seem to be dependent on the higher dose you take, the more likely you are to going to have the problem. So just be aware of that, and also that it does cause an increase in your blood pressure. So if you already have trouble with high blood pressure and you've been taking the NSAID class or drugs in that class, you may notice your blood pressure creeping up, and that's not a good thing. That may lead to more strokes. So be aware of that. Always ask your physician if there are alternatives to this medication.
Our next video is going to be very good about when you've been diagnosed with high cholesterol. You are supposed to eat fat. You're not supposed to have a no-fat diet. So stay tuned so you know what fats actually help you to lower your cholesterol.
Okay, well that's it for today. Thank you for joining us, and we'll see you next week on J&J House Call.
This is good. What you want? What you want? You want to be part of the show? You do? Okay. Here you guys. This is Kona. You see her? There you are. Say hi to everybody.